Namaste. This is Dr. Vaishali Ashok Bhide, MD Homeopathy. Today we will be talking about urticaria. Urticaria, in common terms, means allergic reaction which happens in the body but expresses itself on the skin. It is also called as nettle rash or hives. Urticaria is very common among the population. Around 20% of the people get it at some point of time in their lives. When we say that the allergic reaction had its effect on the respiratory system, we would label it as asthma. In this case, the allergic reaction which happens in the blood, however, the symptoms are seen on the skin. This is what we see in urticaria. Now, before we go into the causes and the symptoms and treatment of urticaria, let's see what actually happens. Whenever our body comes in contact with any pathogen or anything which irritates the body or which is identified as an allergen, antigen and antibody react, which means our body reacts with that object and an inflammatory or allergic cascade starts. Histamine is an enzyme which is released very early, and this causes itching, the intense itching that they experience. Along with this, there is blood vessel or a capillary dilatation which causes redness of the affected part, and as the fluid moves beneath the tissue, there is also swelling. So, because of this allergic reaction, which happens much beneath the skin, the effects are seen on the skin. So, let's see what are the symptoms of urticaria. Intense itching spots are seen on the skin. Initially, when the problem starts, the spots may be as small as 1 to 2 centimeters. However, a few months or few years or few weeks into treatment, the spots can become bigger. Second is you will see raised patches which are red, which means the skin itches. There are red hives or wheals on the skin. This may start as a localized patch but usually become widespread. After certain time, all the patches, all the spots disappear and the skin appears normal as before. So today if a person is having urticarial eruptions, tomorrow morning their skin will look absolutely normal. This is one of the important criteria to diagnose urticaria. It doesn't leave any mark on the skin. Now we will go forward to know causes of urticaria. Now urticaria first we define as acute and chronic. Acute urticaria is labeled such when the problem has just started or it is a few weeks or less than 3 weeks. Then we call it acute urticaria. Chronic urticaria is urticaria which has been there for months and usually more than 3 months. We label it as a chronic urticaria. Now causes of urticaria is usually to do with familial history or autoimmune conditions like rheumatoid arthritis, systemic lupus erythematosus, thyroid disorders. These are commonly associated with urticaria. Again, urticaria we also divide into two types. One is spontaneous and second is inducible. Spontaneous urticaria is when no identifiable cause is found. The skin will suddenly start itch, suddenly the hives will break out, and the person will go through the cascade of symptoms. However, the cause is not identified. And inducible urticaria, there the cause is identified. When they come in contact or when they are exposed to certain things, the itching will start. For example, when they eat certain food products, say it could be eggs for some, poultry for others, or nuts, legumes, their skin will start to itch, become red, and hives will break out. Sometimes we call it as a cold urticaria, where when they are exposed to extreme of cold weather, be it sitting in the AC car or be it sitting in the AC theater, the skin starts to itch. Third is a solar urticaria or heat urticaria, where when they are exposed to extreme sunlight, the urticaria starts, or when their body heats up after exercise, the urticaria will start. Some people will get urticarial rash after experiencing certain emotions very deeply. So, the moment they fear or they panic or they become anxious, their whole body starts itching. These are few common reasons why urticaria will develop. There is also another reason called as a pressure urticaria, where if they would wear a handbag, that pressure will start the rash, or they will use a seat belt of the car, and that is enough to start the cascade. According to these, we know that there are different causes for urticaria. Now let's proceed to the treatment part. As we have said, people who are commonly having autoimmune diseases or hormonal disturbances are, they find it more prevalent that they get urticaria. So we always take a detailed history. A detailed history is taken about the stressful situation, their nature and their reaction pattern. Here we also give utmost importance to know how the urticaria is induced and what helps. For example, with certain people, the moment they take a hot water bath, their whole skin breaks out with a urticarial rash, and they are better with ice application. This happens in some people. In other people, they get their urticaria symptoms only when they are exercising. The moment they stop exercising, the urticaria gets better. So here we typically know that it is the when the body gets heated up after exercise, the urticaria starts. In a few people, they will have proteins and the urticaria will start. So we know it is allergic to food products, which is expressing itself on the skin. So along with their nature, their reaction pattern, we also see the typical manifestations of urticaria in them. What aggravates the urticaria and what ameliorates or reduces the symptoms. All these are matched and the medicine is prescribed. Here it is important to know that we have already seen that because of the reaction in the body of the allergen, the cascade starts. Many times they will see that they will ask us that for many years together I have been having this food but I never got such a problem. Why suddenly my body should become allergic to this? This is precisely where homeopathic medicines act. That whatever was not identified as a problem for years together is suddenly identified as a problem and body reacts and the patient has to experience so many symptoms. So we actually see what has happened before this problem has started, what emotional breakdown or upset the patient has gone through, which has caused the body to become so intensely reactive. This cause is identified and we make the prescription so they no longer remain allergic to the thing to the which they have developed allergy. So this is how treatment of urticaria is done. Here, as a part of lifestyle management, we only request them to initially avoid all the foods that will induce the urticarial rash or the known causes. However, once they start responding to treatment, say a few weeks into treatment, when they are around 70% better, we tell them that now we want them to get exposed to the things which would give them the urticarial rash. So we are sure that the medicines are working, and we see that when they come in contact with the allergen or when they come in contact with the inducible factors, how much, if they get the rash, how much do they get and what is the intensity, accordingly we will change or increase the potency of the medicine. So this is how homeopathic treatment of urticaria is done. I have recently published a book on homeopathic medicine titled Unlocking the Bogus Synoptic Key Part 1. If any of you wishes to have this book, kindly contact me on the WhatsApp number. I am currently practicing in Dadar West Shivaji Park area from 1 o'clock in the afternoon to 7 o'clock in the evening on Mondays, Wednesdays and Fridays. I practice at Park Polyclinic 5 Shankar Nivas, Dada Saheb Regimar, right opposite Shiv Sena Bhavan. And on Tuesdays, Thursdays and Saturdays, I practice at Sapres Polyclinic, Malik Building, DV Deshpande Mark, Shivaji Park Road number 4. You can also follow me on YouTube, Instagram and Facebook. Stay happy, stay healthy, stay blessed. Thank you.